More than 5 million teeth are knocked out every year, but only 9% of adults in the U.S. know what to do if that happens. Joining us today to talk more is the president of the American Association of Endodontists, Stefan Zweig. Welcome to the show.
Thanks, Annie. Nice to be here.
Yeah. Now, talk to me first. Why is oral health care so important?
Well, oral health care is important to maintain oral health, and we know that there are connections between oral health and your overall health and well-being. So the first thing that's the most obvious is that when you don't take care of your teeth, that it can affect your smile, and that can affect your confidence and the way you relate to other people and even your job. So that's the first. Secondly, when you have poor oral health and broken teeth or other disease in your mouth, which is going to cause pain, it's tough to eat. And when you don't eat properly, you're not going to get the proper nutrition, and that's going to affect your overall health. And lastly, we're finding now that there are some connections, potential connections, between your oral health and your overall systemic health and diseases in the body. And specifically, what I'm talking about are diabetes, heart disease, and even oral cancer. So these are all reasons that you need to maintain your oral health.
Absolutely. So what should someone do if their tooth is knocked out?
Well, we're seeing more and more of this happening, and it happens during activities such as bike riding, scooter riding, and sports. And so the first thing is to be very careful that this doesn't happen and take every precaution, such as using mouth guards when you play football or hockey. But when a tooth is knocked out, there is a potential to actually save the tooth. And the first thing you need to do is find the tooth and gently hold it by the crown of the tooth. Make sure that it's clean by rinsing it with water or milk and then repositioning it into the socket where it came from. After that, you really do need to see a dentist to make sure that you've repositioned it correctly and to stabilize the tooth if that's required. And many of these teeth we're finding end up needing root canal treatment. So it's an excellent it would be an excellent choice to see an endodontist who's a specialist in doing endodontic treatment and saving teeth. They have a lot of expertise in dealing with these traumatic injuries. So we like to tell people to see endodontists when they have them.
So how is poor oral health linked to other health issues?
Well, the exact linkage is not fully known. But we know that oral health issues usually involve some kind of bacteria. Cavities are caused by bacteria, and so and other infections have bacteria. So bacteria that starts in the mouth can end up in other places in the body, and there seems to be some kind of link between bacteria and the inflammation that bacteria causes and other diseases in the body. So we're finding out more and more about this. As we study it, we don't have any direct knowledge, we don't have any direct link at the moment, but there does seem to be a link.
So where can our viewers go to learn more?
So the American Association of Endodontists has a website. It's www.findmyendodontist.com. And on that website, you're going to get a lot of information about root canal treatment, about endodontists, who they are and what they do, about saving teeth. And you're also going to have the opportunity to have a search engine which is going to enable you to find an endodontist in your area. So we encourage people when they're told they need root canal treatment or if they have these traumatic injury to seek the help of endodontists. And this is an excellent way to find an endodontist in your area.
Awesome. Stefan, thank you so much for joining us.
Thanks, Annie.